It's Charlie and welcome back to my channel, or welcome to my channel if you're new. Today's video I'm going to be doing another lot of dental nursing questions. I'm so sorry that I haven't posted in like 2 months or something. I don't even have an excuse for it. I've just been really lazy and I've done some work, some like dental nursing work, but it wasn't an excuse not to post enough. I'm actually really trying to move away from the dental nurse videos now, because for me to film them and to edit them, it's getting a little bit boring. I'd rather do something on my channel which I really want to do, and I know obviously a lot of it is what the viewers want and what you guys would like to see and would like to hear. But if you've got anything that you want to see, I can test some life hacks, I can do some beauty videos, I can do some hair videos. Obviously not at the minute, and there's a reason for this crazy hair. I'll explain that in a second. If you want to skip me blabbing on for a little bit, then just go to this timestamp right down here and I'll get straight in with the questions. But if you don't mind sitting for a minute and listening to me talk about what's been going on in my life, then I'm going to talk about it. So let me address this hair issue. I went to the hairdresser and they told me that if I keep straightening my hair every single day, it's just going to die and fall out. And I don't want that. So I'm trying really, really hard to not straighten my hair at the minute and keep as much heat away from it as possible. Obviously I am drying it after I have a shower, but it means that I can't leave my hair down, because when I leave my hair down, it's crazy. I have just ordered Function of Beauty shampoo and conditioner to see if that works, and I really hope it does. And if it does, I'm going to come on here and do a review for you guys if you want to see that. Just let me know in the comments below what kind of videos you would want to see from me, because I want to get away from the whole dental nursing thing now and I want to try and move on to something different. Anyway, with that being said, I'm now going to move on to the questions. So if you want to see the rest of this video, then just keep watching. Okay, so these were questions from like a month ago. I'm really sorry I haven't answered them. I think I answered some of them in the comments, but I did say that I'd answer them in this video, so I'm doing that now. So the first question was, would you say dental nursing is fairly flexible, as in not too full on? Some jobs will take all your free time, but knowing you still have time and passion to pursue acting is really inspiring. So I am just lucky to be on a 0-hour contract in my job. I was full-time for like 3 years or something like that. Yeah, it was 3 years actually. Then I quit last June, so my last working day was like the 29th of June or something. Then I went into the acting stuff on the 1st of July, but still keeping a 0-hour contract to the dentist, which is allowing me the flexibility to be able to say, no, I can't work this day. Currently at this minute, I've got absolutely no work, which is the downside of quitting my job, because I've got no money coming in. I'm not getting the acting work because it's winter and it goes so quiet over the winter. I've literally had nothing since, well, that's a lot. I've had 2 things since November, but it's really hard. And as much as I want to go out and get a job to get money, I don't want to give up on the acting stuff, because that's really what I want to do. And obviously YouTube, I would love to make some money from YouTube. I'm not making anything from it in the minute. I have actually reached the threshold, which is 1,000 subscribers and 4,000 watch hours. But I think you've got to have that for 12 months or something before you even start getting paid. So it's just a snowball of things that are barriers. Anyway, that's kind of going off subject, back to the question. If you are just looking at a dental nursing job, no, it's absolutely not flexible to be doing other stuff. You still do get a social life, like on the weekends and things, if your practice is shut on the weekends, but generally you are going to be contracted. If you do part-time, obviously you'll be contracted part-time, but if you do full-time, you're going to be contracted full-time. I was classed as full-time and I was doing 34 hours or something, so I did have a day off in the week, which allowed me a bit of time to do other stuff. So much of it you have to put into doing work outside of work as well with your CPD, so continued professional development. It's not that much, it's something like 50 hours over 5 years. This is still going off subject. I'm really sorry, I can't just stay on one subject. I'm gonna have to move on to the next question. But to answer that bluntly, no, it's not a flexible job. You've got to put your full-time or your part-time into it, unless you get a 0-hour contract. It's basically how it works. It's just kind of like any other job really. If you're full-time or part-time, that's your commitment, that's what you have to do. Okay, so the next question is, what do you think are the right things to do and prepare for exams? I'm scared of not passing them. I don't know if it's changed, because I did my exams in 2015. 2015. This year it will be 5 years ago that I did my exams. A lot would have changed, I'm imagining. I don't know anything about college anymore. The stuff that they do, all I can go off of is what I personally did in college. I have actually had some comments from people saying, oh, well, you can't be a qualified nurse then if you didn't do this.
Try me, bitch.
I am a qualified nurse. My GDC number is on the register. You can look me up on the internet and see that I'm a registered qualified nurse. Just because I didn't do something in college, which you need to remember was a few years ago, doesn't mean that I didn't pass the exams. Anyway, do you see what I mean? I can't stay on topic. Right, let me get back onto topic. If you don't pass your exams first time, you can resit them. At least that's what it was for me. So we had 4 different exams, and I don't think I passed one of them first try. The rest of them, or maybe I passed 2 of them first try. The other 2, I resat 3 or 4 times, I think. Radiography was really hard, and there was another one which I can't quite remember what it was, but if you're doing it now then you'll probably know. It was really hard to pass and I struggled. If you fail them, you've just got to resit them. Obviously there was a limit, like if you failed 10 times, something's not right. You would then have to resit the whole year, I believe. Generally, you can pretty much, if you fail it, you can resit. Maybe the cut-off point was like 5 times, I'm not really sure. Or if you didn't pass by the end of that year, as in the July, yeah, because then they broke up for summer. So if you didn't pass by the July, you would then have to just resit the year again, because something obviously wasn't quite right there. Don't be scared about it, don't worry about it, you can resit them. I would get your head in a book. Honestly, that's the best advice I can give you, is to get your head in the Levisons, go through it, politely ask somebody to come up with some questions using the book, which you then have to answer. It's honestly the best way to do it. Ask your college if they've got some mock papers for you. It's really hard when a lot of the questions aren't your day-to-day practice, what you do. It's things like, with the radiography, manual processing, which I don't actually know of any practices that still do that, but you still have to learn it. So that's the kind of stuff that's hard, because you don't physically do it, you're just having to go off a book. I would say just get your head in a book. That's how I did it. Before my exam, I would read the chapter on the exam that I was doing. Obviously I did more studying before that, but just so it was fresh in my brain, and that was all that was in my brain. Moving on to the next one. How long do you think it takes to qualify? So there is a couple different routes you can do with college courses. For me personally, I did, I think it was the NVQ. I know there's NVQ or Diploma. I think I did the NVQ. That took 9 months. So it was from September 2015 to July 2016. Yes, it was July that I passed my exams in. To be honest, I think they should be longer than that. I know that other courses are. Some courses take 2 to 3 years or 18 to 24 months to do, which is probably the way it should be, because you can't possibly learn everything you need to know in those 9 months. I had actually started a previous course before, so I started dental nursing in 2014, in September 2014, and I started on a course. I can't really remember that much. It was like some e-learning thing, which you did some of it online, and then you had somebody come out to the practice and ask you questions. I'm not really sure, I can't really remember, but I wasn't getting anywhere with that. And that course should have been, I believe, 2 years. But then the practice switched me over to the college course, and I was able to do that in 9 months. So September 2014, and I was doing this e-learning thing until September 2015. It just wasn't working. So then September 2015, I started the college course, finished in July 2016. Anyway, that, again, I'm blabbing on so much, but for me it took 9 months, but it depends what course you're on. Some of them take 2 to 3 years, 18 to 24 months. It all just depends which course you take, but the minimum amount of time, I think, is 9 months to qualify. Okay, now this one was, can you do a video about how to speak to clients when being a dental nurse? I'm starting a dental nurse apprenticeship in a couple of weeks, and I have no clue what to say to the clients or how to approach them. So this is, it's kind of just standard for how any employee should speak to their customers, clients or patients. You have to have a smile on your face, you have to be polite. I think that's pretty standard across any industry. Even, you know, if you go to a shop and you ask somebody for help, you would expect a a certain amount of respect back. You'd expect them to be polite, you'd expect them to help you. It's exactly the same with dental nursing. You need to have a smile on your face. You don't have to be happy all the time, obviously, but you know, if something's happened at home, you can't then bring that into work and let it affect you too much, because you are dealing with paying patients. They are paying for a service, and there's certain standards to that service. With this particular question, although it's generalised to dental nursing, there isn't a specific way dental nurses necessarily speak to patients. It's just standard across any industry. You have to have a certain amount of professionalism about you. I've had phone calls with patients where I know that I've been really nice to them, but yet they phoned up and said that I was rude. And people are shocked when they hear that, because they know that I'm not rude. It's just to do with the way that you say it. So for example, I've actually had a patient phone up once to complain that I was rude on the phone to her, and the woman that took the phone call was like, "That's not Charlie, no way." And when she asked me about it, I was shocked, because I was nice as pie to her. And what had basically happened is that she'd phoned to cancel a hygienist appointment on the day, and it was within like an hour or two of the appointment. Our practice policy is that we charge for on the day cancellations for the hygienist, not the dentist, just for the hygienist. If there obviously is a genuine reason, like you're on your way but you're stuck in traffic, or you're sick, or whatever the reason is, if there's a genuine reason, we normally wouldn't charge, because you phoned up to say you can't make it, there's a reason for it, and you know, some things can't be helped. So this woman phoned up to say that her husband had just come down ill, so she couldn't leave him. And I said, that's absolutely fine. I told her, I'm sure there won't be a charge, but it's not my final decision to say, because it's practice policy. That's not my rules, that's the practice rules. And it was up to the hygienist whether they charged or not. If I'd have said, no, there won't be a charge, and the hygienist has said, well, actually, I'm not happy about that, so yeah, there will be a charge, I'm going to get in trouble for that, because I've told her no when actually there will be. So I obviously explained to the woman, I'm sure there won't be, but I have to check with the hygienist first, because it's her discretion whether there will or won't be, because at the end of the day, that's her time wasted, her money lost, not mine. So I explained that all to the patient. I was really nice about it as well. I said, I'll explain the situation, I'm sure there won't be, I just have to let you know there could possibly be, I just need to check with the hygienist first. Anyway, she wasn't happy about it and rung up later to say that the service that she got was rude. And honestly, it drives me mad, because I could not have been nicer to her over the phone, but I had to let her know that wasn't my decision to make, and they don't care. They don't want to know, they just want an answer there and then, and sometimes you can't always provide that. I've had so many phone calls like this. In fact, I took one yesterday, and I'm sure that they're going to get a phone call complaining about that, because she was asking me questions which I couldn't answer straight away, and the time when she was asking me these questions, she was on Google. This is why people shouldn't be Googling stuff, because it doesn't always have the correct information on there, or it says it in such a complicated way that they make it sound like you get more than what you actually pay for, sort of thing. What was the question? I don't think I've answered a single question in this video which has just been that question specific. I bet this time has run out as well. Hang on. No, we're still good, still recording. Let me find the question again. Oh, how to speak to clients. Basically, just be as nice as you possibly can. Do everything you can to help them. It's not always going to go your way, but yeah, anything dental nurse specific, I can't really think of anything I would say. Sorry, it's a piece of fluff there and it's annoying me. I can't think of anything I would say to a patient that is very dental nurse specific, unless they're asking you dental nurse questions. Oh, for goodness sake. Sorry about the change in angle, if there have been one. I've tried to make it as not changeable as possible. My camera died. As far as speaking to clients, I would say you want them to leave having had a positive experience in the dental practice. That's pretty much all I can really say on it, because I can't really think of anything specific that a dental nurse would say that any other job wouldn't, unless it's obviously dental related, and I don't know what questions people are going to ask you, so that's kind of a tough question to answer. But just be happy with the patient, be positive, try and help them as best as you can. Obviously there's going to be patients that get narky with you, that want to have a go at you. You've just got to be as professional as you can. You want the patient to leave having had a positive experience in the dental practice. You pretty much just want to avoid them making any complaints about you. Anyway, that is it for this Q&A video. I am happy to answer more questions, and I will do another video about it. It won't be the next one, it's probably not going to be the next one after that, but comment in the box below any other videos you want to see from me. I'd love to do other types of videos, not just dental nurse specific, so if there's something you want to see, testing life hacks, cooking, doing a hair tutorial, whatever it is, just let me know and I will try and get that uploaded for you. Please go and check out Poltergeist on Amazon Prime. That's a film that I was in last year. It's just 30 minutes and it's just a bit of a laugh. So that will be in the link in the description below. I've literally forgotten my outro. Please give this video a thumbs up if you liked it. Click that subscribe button down below and I will see you in my next video. Bye!